Democratic presidential hopeful Kamala Harris is revealing a new plan for government-backed health care this morning ahead of this week's Democratic debates. Fellow 2020 candidate Bernie Sanders made an international trip yesterday to make a point about health care costs. Ed O'Keefe is keeping track of the candidates' plans. Ed, what's behind this focus on health care?
Well, Michelle, good morning. Voters tell us health care remains a top-of-mind concern, specifically health care costs. A recent CBS News Battleground Tracker survey of early primary states finds that 3 in 4 Democrats say they must hear a candidate's proposal for lowering health care costs before voting for them.
We're American citizens. How can that be that in the United States of America that I am paying so much for insulin?
Vermont Senator Bernie Sanders on Sunday crossed the border into Canada with people seeking cheaper diabetes medication.
Depending on where you live, it'll cost $350, $400. Here in Canada, it will cost $35 or $40.
Sanders is the lead advocate for Medicare for All, a new government-backed health care system. It would virtually eliminate the private health care industry.
Health care accounts for almost 20% of our GDP. It's vitally important to the American people. It's unaffordable right now.
Several other presidential contenders support Sanders' idea, or some version of it.
Health care is a fundamental right, and we will deliver that right with Medicare for all.
If California Senator Kamala Harris has her way, Medicare for All would be implemented over 10 years instead of 4 years, as Sanders wants. It would give private insurers a role in the system by allowing them to provide a Medicare plan. And she'd pay for the plan by raising taxes on people making more than $100,000 a year. Sanders' plan would tax virtually everyone.
Bernie's been honest. It's going to cost, it's going to raise tax in the middle class. Well, you got to find $30 to $40 trillion somewhere. And how are you going to do it?
Former Vice President Joe Biden's plan preserves and expands Obamacare. It would cost $750 billion over the next decade and would provide a public option if needed. Biden's plan would allow Americans to import cheaper drugs from overseas and be paid for in part by ending the Trump tax cuts. Tony?
And Ed, we remember that the U.S. is unique among its peers in not capping prescription drug prices. That's one reason why the costs are out of control. I'm curious, though, with the debates coming up over the next 2 days, what are the other issues that are likely to be at center stage? Well, certainly health care, given that polling continues to show it's a top-of-mind concern. Likely some discussion of what the president has been saying and doing in the last few weeks. And we should also anticipate, given that it's happening in Detroit, that there might be some conversation about trade. Obviously, with the automobile industry focused and based in Michigan, it would be a top-of-mind concern to voters there.
All right, Ed, thanks.